My field of expertise has always been in the face and the neck. We've spent many, many years perfecting our technique and teaching it to other plastic surgeons around the world and in our national community. And when one looks at the face, one looks at it generally from a position of laxity of skin, laxity of the facial muscles of certain types, and the reduction and sagging of fat. And patients will present with different types of problems. Some will have all three, some will have two, some will have one. The obligation of the plastic surgeon is to look at all three and determine which one or which of the three or all three needs to be addressed. In some patients that have a very early onset of these findings, it need not be done by surgery, because there are other methods that we have in the office that are minimally invasive surgical procedures or even non-surgical procedures to address the aging processes of the face. But from a surgical standpoint, one of the main areas that we address is not the skin. The skin is very important, but the skin is not the most important part of a facelift. The most important part is the muscles that are underneath the skin that create certain anatomical findings of aging, such as the pre-jowl area, the marionette fold area, the sagging of the midface. Equally important, and probably more important today, because of our research in this particular area, is the wasting away of the midface fat. When this occurs, it can create certain problems such as the hollowness at the lid-cheek junction and the irregularities in the front of the face. Part of our procedures is to not only elevate that fat that has descended, but also to restore that fat. In order to do that, we have to be able to take fat safely from another part of the body, for example, the abdomen, process it in the best particular way that we have, because we have many ways of processing fat, because I'm an investigator and consultant for these companies, and combine it with active ingredients such as platelets, which are called platelet-rich plasma, for their ability to release the growth factors. And the combination of good processed fat and with the platelets gives us the ability to provide patients with a long-lasting effect of fat grafting. Fat grafting, along with the muscle adjustments, and lastly is the skin adjustment, gives you the framework to give you a very natural appearance to the face without any distortion. It so happens that the lower third of the face is also the neck. And the reason it is the neck is that the neck muscles that go from the collarbone level, for example, up to the mandible, also goes up and over the mandible to reside in the lower third of the midface. So that lower third of the midface constitutes both face and neck. The findings in the neck are the same three: the skin, the fat, and the muscles. Of those, the most important is the muscle, not the skin. The muscle that is important there is called the platysma neck muscle, that which begins just below the collarbone and goes up the entire lateral neck and up and over the mandible to reside then on the lower third of the midface. In the majority of patients, the two muscles on either side are together in the midline of the neck. With aging, they tend to come apart, and when they do so, they present what you would be calling the double chin or the turkey gobbler deformity. It happens in males, and it happens in females. It can happen very early on. It can happen at a later time in life. But when those particular muscles come apart and produces the banding of the front of the neck, there's an opportunity for fat underneath the muscle to come through that opening, because it is now open, and that creates the bulge underneath the chin. So fat is of importance in a rejuvenated neck, not only in the central portion of the neck, but also sometimes there's just too much fat to the full neck. Those elements need to be addressed surgically. A full surgical procedure would require minimal suctioning being done, and again, it is for us, it is not how much fat you take away, but how much fat you leave in. Too much fat taken away gives a skeletonized look. We want a natural look, so some of the fat is removed but sculptured. More importantly, the muscles are brought together in the middle of the neck and also adjusted laterally for correction of the pre-jowl jowl area and the laxity of the lateral neck. We've already taken care of the front of the neck, and then the skin is going to be adjusted. The skin is not the most important part of a neck lift because that is not a good structure and fabric to be adjusted because of its laxity intrinsically. It is the muscle that gives the support. When the skin is adjusted, it must be done in a very judicious manner, because if there are wrinkles that are embedded in the skin and you position that skin in an abnormal direction, the wrinkle lines will go in a very unusual direction. But the skin must be adjusted, but must be adjusted so that you get a very natural appearance without an overpull look, for example, to the corners of the mouth, or to the eyes, or to the neck.